Recently, President Donald Trump made headlines by linking the use of acetaminophen, widely known as Tylenol, during pregnancy with the risk of autism spectrum disorder, ASD, in children. His statement sparked widespread concern and significant public attention, leading to confusion about the safety of this commonly used medication during pregnancy. What exactly did the president say? While many reports simplified his message to imply that Tylenol causes autism, his actual statement was more cautious and nuanced. He warned that acetaminophen use during pregnancy may be associated with an increased risk of neurodevelopmental disorders such as autism and ADHD. He urged pregnant women to avoid using Tylenol unless absolutely necessary, advocating for minimal exposure and promoting caution. The administration also announced plans for the Food and Drug Administration, FDA, to update acetaminophen product labeling to include warnings about potential associations with neurological risks. However, the FDA and the administration were clear that a causal relationship has not been established and emphasized ongoing studies to better understand these risks. What does science actually say? The scientific community is actively studying the possible links between prenatal acetaminophen exposure and autism. Several large observational studies have reported statistical associations between extended or heavy use of acetaminophen during pregnancy and a modestly increased risk of neurodevelopmental conditions. However, it is critical to understand these studies demonstrate correlation, not causation. Many factors, including genetics and environmental variables, complicate the findings. More rigorous studies, such as sibling comparison designs, have not found conclusive evidence linking acetaminophen to autism, indicating that other confounders explain much of the association. Consequently, leading health organizations such as the American College of Obstetricians and Gynecologists, ACOG, Autism Science Foundation, and the World Health Organization continue to maintain that acetaminophen is generally safe for use during pregnancy when taken as directed and for the shortest necessary duration. Why the misunderstanding? The public reaction to President Trump's remarks has often been a blanket interpretation that Tylenol causes autism. This interpretation is misleading and oversimplifies the scientific discourse. The administration's strong caution, delivered without new definitive studies, has understandably caused fear among expectant mothers and caregivers. Experts warn that such alarm, without clear evidence, can lead to unintended consequences, including pregnant women avoiding medically necessary pain and fever relief treatments, which in some cases could harm mother and fetus more than the medication itself. Looking ahead, it's important for the public to stay informed through trusted scientific sources and consult healthcare professionals before making medication decisions during pregnancy. Researchers are actively investigating the potential risks of acetaminophen exposure to better guide clinical practice, but current evidence does not prove that typical Tylenol use causes autism. In conclusion, President Trump's message serves as a cautionary note but does not constitute scientific proof that acetaminophen causes autism. Clear communication and continuing research are crucial to navigate this complex issue without causing unnecessary panic or confusion.